I mentioned on-axis implantation in the title or in the title page of this presentation because most of these ICLs were not implanted on the 0 to 180 horizontal meridian. And post-op measurements were made objective with the OPD3. It was prospective, it was conducted prospectively at 6 months. Calculated by vector analysis is a very attractive idea. The sulcus to sulcus is the anatomic variant that provides the horizontal compression to the ICL. It provides natural vaulting of the ICL that is inherent upon the material properties of the lens itself. And of course, this stable vaulting results in a clinically stable anterior-posterior forces at either side of the ICL that we think is going to provide a very stable. This study was conducted prospectively. It included 76 eyes of 76 patients. Only one eye was taken from one patient. We were able to manage to follow up 66 of these patients, and manual markings were made with the pen, yes, with the pen at the slit lamp, and up to 22 degrees of rotation was allowed for ICL implantation. See that the markings are centered on the first Purkinje, in other words, on the visual axis of this patient. Both eyes were aligned, were checked to be aligned horizontally before any markings were made. Angulation measurements were made with the OPD3, retro images, and it's quite easy and very reproducible. I tried to find some literature on the reproducibility of this technique, but I was not able to do so, but take my word for it, the reproducibility is within 0.1 degree. 80% and less than a quarter diopter of refractive astigmatism at 6 months. And if we look at this change in angulation graphically, we see from the intended angulation to day 1, measured by a retro image on the OPD3, the delta angulation was on average 2.6 degrees, give or take some. So most of the rotation that we find at 6 months was performed, we were getting it either. Yes, most of these, all of these measurements for ICL sizing were performed at the horizontal meridian. White to whites, UBM sulcus to sulcus measurements, whatever. However, most of these lenses were implanted not at the horizontal meridian, but off axis, or for a lack of a better word, isolate, on axis. So I did a correlation analysis of these 66 eyes. Now the x-axis shows the intended angle of implantation. It's from 0 to 22. The y-axis shows the achieved degree of angulation at 6 months. That's delta angulation. So, if that hypothesis is correct, that there is more rotation if the implanted angle was further from the horizontal meridian, and the amount of delta rotation at 6 months. So I think it is safe to say that on degrees provides excellent visual results. On axis, V4C Toric ICL implantation of up to 22 degrees provides excellent rotational stability up to 6 months.